everybody. Thanks for tuning in to Sapphire Snuggles Resource Zone TV. Glad to have you here. So, today we are discussing cervical polyps. What are they? How are they caused? And how can they be treated? Very short segment, not going to keep you long. So, just to keep you informed. So, what are cervical polyps? Cervical polyps are smooth red finger like growths that occur on the cervix or in the cervix, the passage between the uterus and the vagina. Um, so we know that is like the gateway to the vagina, and it's like a little short tube shape. So what causes the polyps? Um, it's not entirely understood why the polyps come, but they do occur. Some can occur from infections, also long term chronic conditions, inflammation, an abnormal response to an increase in estrogen. Ladies, you got to keep that estrogen balance, or else it will spiral out of control. Whether low estrogen or high estrogen, something will occur that we truly don't want to deal with. Um, it's a congestion of blood vessels within the cervical canal. So it just gets out of whack when those growths appear. So what are the common symptoms of polyps? So you can have abnormal bleeding between menstrual cycles, after menopause, after you go through that term of menopause, after sexual intercourse, and after douching. So please be aware of the signs of your body and how your cycle tends to occur. They rarely can become infected. However, it can cause your discharge to be yellow, off-white mucus, and they usually happen without symptoms. So that will probably be something like ultrasonic, or something that your doctor would have to figure out, or if you're having pain. So always make sure that you paying attention to your body. So how are they treated? Hmm. The most common treatment is being removed during a pelvic examination, and that can be done like just in a office setting. It's not really an inpatient type of thing. So they just do like a special type of forcep and just basically just cut them. It's that's the only way they can get rid of them right now, until technology come up with some other type of procedure. So should cervical polyps be tested? Almost all of them are non-cancerous, which is benign, but your doctor may want to send it off to the lab just to have it tested, just to make sure that we are checking off all boxes to make sure there isn't any cancerous cells presented in the cervix or the cervix polyps. So it's always a good thing just to have it sent off, just to be the extra layer of extra precautionary measures. So who is affected by cervical polyps the most? So they most often occur in women after 20 um, childbearing years, after several pregnancies. Um, Most cervical polyps are discovered during a pelvic exam, so they are seen, and a single polyp develops. So they are seen in the regular like pap smear, annual, and that's when your doctor can discuss other options to see where we can go further and to guide you when where you need to be. So that was all I had for you. I know that's not like a real interesting subject, but it is very important. Um, I hope this was informative. Thank you for tuning in to Sapphire Snuggles Resource on TV, and I will see you next time. Please like and subscribe. Thank you. Bye.